Well, I'm here at the SEPA 2019 conference with Anton Sculean, who is a frequent visitor to SEPA events. He'll be talking in a short while about crown lengthening. So, Anton, I just wanted to ask you if you can give us a helpful summary of the procedure, which is always faces its finite limits. How can the clinician work within those limits to maximize the outcomes?
I mean, in my talk I will like to point out about certain aspects related to crown lengthening, because this is still an important procedure in periodontal surgery. And in fact we have two aims. First, we would like to re-establish periodontal health and periodontal maintenance to enable plaque control for the patient. And of course the second aspect is to improve aesthetics. So in my talk I will try to give some evidence based on the literature about the wound healing related to crown lengthening, and then based on clinical cases and surgical video to exemplify how we do it step by step before we come to some conclusions.
Those are the actual procedures, but planning is very important.
Yes.
In this.
I mean, what I want to point out in my lecture is that the planning, and a very proper planning, is the key issue in order to obtain a predictable outcome. And thorough analysis of the patient and of the tissues, including hard tissue and soft tissue, are the prerequisite in obtaining successful outcome.
And the planning is very important for the proportion of the tissues that you're
Yes,
working
for a
with.
proportion, and of course we have to look at the indications, whether we need to have soft tissue removal and hard tissue removal, or we only need to remove soft tissue, because this is an essential aspect. And of course we have to look also at the phenotype of the patient, because we know that patients with a thin tissue and not wide enough keratinized soft tissues react in a different way compared to patients with a very thin tissue. And I think this is an important message to the clinician.
Yes, yes. If I can change the subject now to the question of this SEPA Congress and this society, the Spanish Society of Periodontology. You've been coming to events here for many years, and you've had a very close association with Mariano Sanz and all the Spanish experts. How have you seen this evolve over the years?
I think SEPA made, especially during the last 10 years, tremendous progress. And first of all, they have an excellent organization, a fantastic logistic behind, and of course the quality of the meetings is also outstanding. This young generation of Spanish specialists that are in the board of the SEPA, they are incredibly motivated, and they really try to push their ideas forward. And I think that they managed to become a true leader in the field, not only in Europe but also globally. And I think among the periodontal societies in Europe, I would say that SEPA is the leader. So we have to accept this as a fantastic achievement, and they are not only a leader in Europe but also globally. And I'm very proud of my friends from Spain, and I would like to congratulate them for the 60th anniversary. So felicitas SEPA 60 años.